As it turns out, just like the shoemaker's children don't have good shoes, the spine surgeon did not have a very good back. And between 1981 and 1996, I'd had 3 surgical discectomies performed. And those of us who are in the field know that when you operate upon a disc and remove the herniation, you do not have a normal disc. And I went on to develop degenerative disc disease. So while I was chief of staff at Norwalk Hospital, and as orthopedics had moved minimally invasive, I was wearing lead 8 hours a day, 2 to 3 days a week. And I started developing some really severe low back pain. I had some additional studies done. Pain management doctor in my group began performing procedures on me to get some relief. But by 2010, I really had little to no quality of life. So my wife, who'd been with me since the first year of medical school and had been on this journey and odyssey with me, said, okay, if there's no surgical solution, what would you tell your patients? You need to modify your lifestyle and whatever you do to minimize your pain. And so Norwalk Hospital had a new president at that time. I'd worked closely with him. And he said, hey, we really don't have any physician leadership in the hospital here. Would you come join the administration so that we can have some physician input on when we're making decisions? So I wound up doing that beginning in 2010 and into 2011 and left my orthopedic group. And I think one of the big questions a lot of people get when they wind up doing an executive program is, so what are you going to do with it? And I think it's okay to go into it and saying, well, I'm not really sure, because education, and we've talked about this before, education is really important. When I began my practice, that senior doctor who had begun the practice a quarter century before, in the early 1960s, when I joined the group, he was doing knee arthroscopy and total hip replacements. So I said, Jerry, none of these existed when you began your practice in the mid-60s. He goes, yeah, even Medicare didn't exist when I began practice. And I said, why are you doing these? He said, well, because all I did was fix a lot of fractures, make a lot of big scars on people's bodies. But I realized if I was going to continue to be relevant as a clinician, you must continue with continuing education. And I really do look at, for me personally, and for those people that have an administrative ill, that PEMBA gives you that. That's that continuing education. It's not medical education in this case, although we're using it hopefully in a medical field, but it's really broadening our skill set to be able to take on additional challenges.